Josh Stripling with Denver Chiropractic Center, and we're here today at CrossFit Conquer in beautiful Denver, Colorado to talk a little bit with you today about shoulder pain, injuries, and what you can do to actively strengthen and stabilize the joint. Many people every day experience chronic shoulder problems, and with this structure, there are many different types of tissues that can be involved. It could be a muscular problem, tendon problem, the capsule, which holds the humeral head, could be involved, and also could be impeded nerve flow or disrupted nerve flow coming down from the spine. And the biggest thing that we see today in the office is that most of the pain is due to rotator cuff muscles. The four rotator cuff muscles, which include the supraspinatus, which along with the deltoid is responsible for abduction of the shoulder, the infraspinatus and teres minor, which are responsible for external rotation of the shoulder, and the subscapularis, which is responsible for internal rotation of the shoulder. And many times when these muscles become chronically overused, they become shortened, very stiff, and very fibrotic. And over a long enough time, they affect the position of the arm within the socket, and this creates and causes tremendous stress within the joint. And today what we're going to do is give you some exercises so that you can take responsibility for your own health and become proactive to help prevent injuries that include frozen shoulder, impingement sign, and other such injuries that involve the shoulder. The first exercise that we're going to do is great for people who have adhesive capsulitis or frozen shoulder, or just very serious problems, very acute problems. And this is called the Codman exercise. So what you're going to do is almost get into like you're doing a standing row, and you're going to use your arm almost as a pendulum and just let it kind of hang there. And this is for people with very decreased range of motion. And you're going to do about 10 one way, and just let the arm go limp and just let it do small concentric circles. And then you're going to reverse that. And even if the shoulder is only affected, say on the right side, we're going to work everything bilaterally so that we don't create any asymmetries within the body. And one important thing to mention is the shoulder itself, which has such great range of motion and great mobility. This also inversely affects the stability, which makes it much more prone to injuries. The next exercise is range of motion exercise, and it's walking up the wall. So you're starting your arm out spread, and you're slowly walk up the wall, and step closer and get to that position where like you're in range of motion, and you're going to hold that for 10 seconds, and then slowly you're going to walk back down, and with each arm you're going to do about 3 times. And the next exercise is the PVC. So we're just working the range of motion here, get it really warmed up, and I apologize for my pit stains, but yeah, you'll have to deal with that. So the first one we're going to do is just a pull through. So what it really looks like is doing a clean press with a barbell. So you're going to start, just raise the shoulders, stay very close to the body, externally rotate those shoulders, and then push up. And then like you're in a push press, push behind as much external rotation as you can. And really try to get that head through the arms. And then you come back down. And you're going to do about 10 reps on each, 10 reps for this. And then the next one with the PVC pipe, or you can also use a towel, just pulled taut. You're just going to start doing big circles. And my range of motion is not the best. I had a slap lesion surgery about 2 years ago after 5 dislocations playing rugby. But it's slowly getting better. So what you really want to do is just work that range of motion. And then you can start doing like circles up this. And everything we're going to keep it real simple. Do about 10 reps for everything that we do. And the next one we're going to work specifically the muscles. So you can use either an elastic band, elastic rope, it doesn't really matter. And first thing we're going to do is work the internal rotation, which is working the subscapularis. So anchor your rope or band to something solid. And the further you step out, obviously it'll be more tension and more of a challenge. And the biggest thing you want to do is keep that elbow tight within the body. So for the subscapularis, do an internal rotation, thing, like I said, is keeping that elbow tight within the body. And then, obviously, we're going to do it on both sides. And we're going to work with external rotation, which involves infraspinatus and teres minor. So you're going to stand and do external rotation as much as you can. It's a full end range of motion. And for these, we're going to try to do maybe 3 sets of 10 for each one. And the final thing we're going to hit today, just keep it real short and sweet, is a little trigger point therapy. Now in our office, we actually have the trigger point balls, but if you're doing this at home, and we're going to start with an area, do about 2 or 3 minutes for each time, and you can do this every day. And so if you're doing it at home, start with a tennis ball or a racquetball, and then after a few weeks you can progress to a lacrosse ball. And you can use these, but stay away from baseballs because you want to have something that has a little bit of give to it. So for this, what you're going to do is come on your side, and we're going to position the ball right where the armpit and the arm meet. So we're really targeting the subscapularis and teres minor here. And just kind of move the ball around a little bit until you really find that tender area, and you'll know when you find it. You can move your elbow up and down until you find it. So once you do, we're going to slowly work external rotation and then internal rotation. And if you want, you can apply a little more pressure, but just don't go crazy on it. You're going to do about 10 motions, about 10 reps for this, and then do both sides. Now in addition to these stabilizing and strengthening exercises for the shoulder, which are very important and should be done at least 3 to 4 times a week as a strengthening program. It's great as a cool down, and it also makes an excellent dynamic warm-up. So if you're playing sports or preparing to weight train, it's a must for a dynamic warm-up. Just get those joints nice and loose. And along with these exercises, I'm a firm believer in a consistent preventative care program, especially if you're have an active lifestyle or are an athlete. And what we do in the office is active release technique, also known as ART. And this is a soft tissue therapy that we use to manually go in and break up the adhesions, scar tissue, and fibrosis within the tissue and all around it. And a lot of times as chiropractors, we always check the spine for proper mobility and alignment. And almost every time that we see a shoulder complaint, the mid to upper thoracics and the lower cervical spine are almost always hypomobile. So we're going to check that range of motion, check the mobility, and if need be, we will try gentle adjusting into that segment. It's very specific, it feels good. You may experience like the cavitation, the pop, but it's a very simple and gentle adjustment. And along with that, and the strengthening exercises, active release technique, it just creates a great program to help you move fully and freely and just increase your performance on the field and stay off injuries. Thanks a lot, guys, and we're going to see you next week. We're going to talk about plantar fasciitis and how to improve that. Thanks a lot.